Welcome back, ladies. In part 1 of this series, I gave you a summary of vaginal rejuvenation. I compared it to laser treatments and introduced you to both Thermiva and Votiva radiofrequency treatments. Click here if you did not see that video and watch part 1. Today, we're going to continue our vaginal rejuvenation series by discussing additional technologies that I think are at the forefront of this very exciting field. So if you're a woman, or you know a woman, or simply just not feeling anything down there in the holy land of pleasure, the Hoo Ha Healer is here to tell you that you do not have to grin and bear it. Welcome to Skin Fiction, where we don't just talk about skin, we get under it, over it, and sometimes even around it. This time with a little more radio frequency magic. So let's dive into the next technology. It's called VTone. Basically, it's giving your vagina a gym membership. Your pelvic floor is like a gym membership. You sign up, but sometimes it just needs a little extra push. VTone is that push. No sweat, no squats, just a little zap to get those muscles working again. So what is VTone? It's a non-invasive treatment that uses electrical muscle stimulation, or EMS, to tighten up your pelvic floor. Basically, it's like giving your vagina a workout, but you don't have to do anything. Bladder leaks? Gone. Feeling a little loose? Let's firm that up. Small device is placed inside your lady parts, and it sends electrical pulses to make your muscles contract. It's painless because we can cater it to your tolerance. Takes about 15 to 20 minutes. You'll feel a little tingling sensation or a little contraction as it works its magic. It's kind of like Kegels on autopilot. Before treatment, just make sure you're clean and tidy down there. Don't worry, we're not asking for a full Brazilian. During the treatment, the device does its thing, sending pulses throughout the pelvic floor while you kick back and relax. After the treatment, there's zero downtime. You can go back to your life like nothing happened. No one will even know you just gave your vagina a workout. Now, you will need 4 to 8 sessions, depending on your symptoms, about a week apart to see the full effect. After that, you'll want a quick tune-up about every 6 months to keep symptoms at bay. Expect less leakage, more control, and better sensation when it counts. No Kegels are required. Let's talk about 2 more power players in the vaginal rejuvenation game. Morpheus 8V and Votiva, also known as Forma V. Those 2 names are interchangeable. These treatments combine cutting-edge technology with real transformative results, again, without the need for surgery. If you're looking for the ultimate glow-up below the belt, these might be exactly what you need. Morpheus 8, the microneedling powerhouse, is like the high-tech facelift for your vagina. But instead of scalpels and stitches, we're talking about microneedling combined with radio frequency energy to tighten, tone, and restore vaginal and vulvar tissues. It's all about stimulating collagen and elastin production, tightening tissue, strengthening the pelvic floor for better function and appearance. Morpheus 8 uses gold-coated microneedles.
I love gold!
As you can see here, to deliver radio frequency energy deep into the tissue, up to 3 millimeters deep. This electrocoagulation and fractional bulk heating stimulates collagen contraction and regeneration. The result is tighter, stronger, and more youthful vaginal tissue. The benefits that Morpheus 8V has include a tighter vaginal canal and enhanced pelvic floor strength, improved lubrication and comfort during intercourse, reduction in urinary incontinence. It's actually FDA approved for this, enhanced labial appearance, long-lasting results. The effects can last 18 months or even longer. I've seen it last 2 to 3 years. Now, the process of Morpheus 8V is a little bit different than the previous non-invasive treatments. Although it's non-surgical, we have to use an anesthetic cream for an hour prior to treatment. Ow! It's a little bit more on the invasive side and the discomfort side, but this anesthetic cream is is awesome. The sessions take about 20 minutes, and that's when this specialized wand delivers radio frequency energy with microneedles into the vaginal and the vulvar tissues. Mild redness or swelling will occur, but they usually resolve in just a couple of days. Downtime, almost none. You may be uncomfortable for about 24 hours, but I ask you to avoid sex and strenuous activities for 72 hours, and then you're good to go. For best results, we recommend 1 to 3 sessions spaced about 4 to 6 weeks apart, depending on your healing time. Some women notice a difference after just 1 treatment. The third technology we're going to speak about is Votiva, also known as Forma V. It's the gentle rejuvenation option. It's sort of like the counterpart to Thermiva. So if you're looking for a non-invasive vaginal treatment that's quick and gives you results, this is for you. Forma V uses radiofrequency energy to increase blood flow, stimulate collagen, and restore elasticity. This is the handpiece that's used. It's quick, it's comfortable, it's about the size of a tampon, and effective. It's an effective way to enhance vaginal health and function. The procedure is pain-free, requires 0 downtime. So you can go back to work, and you can go back to work.
You better work.
The same day. Why choose Morpheus 8V or Forma V Votiva? Both of them are excellent options for women looking to restore their confidence, to enhance pleasure, and take control of their intimate health without surgery and without long recovery times. So whether you need a deep tissue transformation like Morpheus 8V or a gentle yet effective refresh like Votiva Forma V, these treatments deliver real results that help you feel your best self, inside and out. So if your vagina deserves a glow up, and all vaginas do, why not give it the best technology available? Let's talk about when energy-based treatments just aren't enough. Now, if things are truly seriously loose, you gave birth to 3 10-pound babies, surgery may still be an option for you. If you are literally 36 years old with 6 vaginal births, wearing Depends before the age of 40, it may be that you need a combination. You need to treat the tissue itself and have surgery. Because remember, the surgical labiaplasties, vaginoplasties, cannot affect the dryness you experience, the pain you experience as those tissues get older. So the combination, if needed, to treat looseness, excess tissue, and urinary incontinence may be what you need. Remember, surgery is not without risks, infection, long healing times. You'll need probably a couple of weeks off, no tampons or sex for 2 months. Not easy, but for those suffering to that extreme, it may be worth it. So whether you go the non-surgical or surgical or both, vaginal rejuvenation isn't about vanity. This is super important. It's about quality of life. Feeling confident, pain-free, and in control isn't too much to ask. Until next time, please like and subscribe if you like this material, and we'll give you more. If you have any questions, please comment below. If you've had these treatments, whether they were successful or not, I can't imagine, please leave a comment below. And again, if you want to listen to real people that have had real results, watch these video testimonials. Until then, we'll see you next time.